In Chapter 21 of your Darby Walsh, we're going to cover the oral systemic health connection. This chapter gives you a broad overview of some of the most common health issues associated with periodontitis. Your learning outcomes for this chapter are that by the end of studying it, you will be able to explain why the oral systemic health connection is important in providing evidence-based care, discuss how cardiovascular disease, diabetes, and pregnancy can affect oral health, and you'll be able to incorporate periodontal systemic evidence into treatment and practice and educate patients about areas of association between periodontal disease and systemic disease, as well as how these associations influence the patient's risk of developing periodontal disease and/or systemic disease. You'll also be able to determine the need for referrals to primary care providers for dental patients with systemic diseases. The relationship between periodontal diseases and systemic diseases is complex. It's well known among healthcare professionals that there are relations between the two. There are three main topics for causal association between periodontal disease and systemic diseases. The first one being epidemiologic association, basically meaning they share the same bacteria. The biological plausibility, that just makes sense, and the impact of intervention of one disease on the second disease. Basically, that would be if you had a patient that had uncontrolled periodontitis and uncontrolled diabetes. If we're able to get the periodontal disease under control by performing SRP and having that patient improve their oral home care, and we see them every 3 months to keep the bacterial load as low as possible and increase their gingival health, then they may have better glycemic control from their diabetes. Here's a picture that we found online that basically gives you different facts for the oral systemic connection. The mouth really is the window to the entire body, and it makes sense that the bacteria that we have in our mouths that were being swallowed, and this can be absorbed into the bloodstream. It's critical as healthcare providers that we're able to understand the systemic diseases associated with periodontitis. One of the diseases that we're going to cover more in depth next semester, but just hit on a little bit through this chapter, is cardiovascular diseases. Arteriosclerotic cardiovascular disease is when the lining of the arteries narrows with buildup of deposits called plaque. They have found the same periodontal bacteria associated with periodontal disease inside the plaque of arteries of patients that have ACVD. The narrowing of these arteries and this plaque buildup can cause the patient to experience angina, a heart attack, stroke, ischemic attack, peripheral arterial disease. 1 in 4 Americans die of heart disease, and it's the leading cause of death among men and women in the United States. So it's important as a healthcare provider that we are educating our patients on this relationship and also educating them on lifestyle modifications they can make to help improve their chances of not getting cardiovascular disease. So what problems could poor dental health cause? Like we just stated, heart disease is a big factor associated with periodontal disease. If we have uncontrolled periodontitis, the bacteria could enter our bloodstream and affect the lining of our arteries, which is going to impact our heart. Patients who choose to use nicotine products and or drink are increasing their risk for oral cancer, as these carcinogens are absorbing into the buccal mucosa and getting into the bloodstream. Patients with periodontitis are twice as likely to be diabetic. Gum disease, tooth loss, and bad breath and dental decay are all associated with poor oral home care and diet. Lung conditions, aspirating saliva filled with bacteria can cause lung problems, and strokes. First, we're going to take a quick look at diabetes. You're going to see patients with both type 1, type 2, and potentially gestational diabetes. Type 1 is less common. This is typically diagnosed in patients who are younger. Most often they're not overweight. This is where their body has completely stopped making insulin. Type 2 diabetics tend to have, they're producing insulin, but their bodies aren't using it correctly, and they can't always regulate it without medication. Type 2 diabetics, though, are able to change some of the modifiable risk factors to improve their glycemic control, as where a type 1 diabetic will be insulin dependent no matter what because their body is not producing insulin at all. So risk factors for diabetes: being overweight. Now in our clinic, if you see a patient whose BMI puts them into an ASA3 category, which means their BMI is over 40, yet they state they do not have a history of diabetes, you are going to take a glucose reading. The patient may have not been diagnosed yet. They may not be seeing their primary care physician regularly, but they are at higher risk for developing diabetes just because they're overweight. Physical inactivity, which often goes hand in hand with being overweight. A family history of type 2 diabetes. Their race, their age, abnormal cholesterol levels, which is going to go back to maybe doing some nutritional counseling with this patient. And if they had a history of gestational diabetes. If the patient was diabetic while they were pregnant, they're more likely to develop type 2 diabetes later on. Diabetes affects more than 29 million adults in the United States. It really has become a chronic problem. A lot of that is associated to the American diet. Hyperglycemia, having a high blood glucose level, can negatively affect the periodontal diseases. In general, poorly controlled levels of blood glucose can place a patient at high risk for developing infections. And diabetics are also slow healers. That's why you see patients with poorly controlled diabetes that have had to have amputations done. Same thing orally. If they have an oral infection, their body is not going to fight that the same way a healthy patient would if their glucose levels are not under control. Adverse pregnancy outcomes associated with periodontitis have also been studied. So some adverse outcomes for pregnancy would be low birth weight, preterm birth, or preeclampsia. Preeclampsia is a pregnancy complication in which the mother experiences high blood pressure in addition to signs of damage to other organs. Often it's going to be the kidneys or the liver. Preeclampsia is very dangerous for both the mother and the baby and can be potentially fatal. Most often, if a patient has preeclampsia, they're hospitalized, closely monitored, and often the baby is born early in order to save the baby and the mother. Once a patient lets you know they are pregnant, you want to identify the stage of pregnancy in which they're at, which trimester, and perform a comprehensive oral and periodontal examination. If a pregnant patient has periodontitis, then SRP should be provided, and if possible, more invasive surgical procedures should be delayed until after the baby is delivered. So it is okay, and we encourage our pregnant patients to stay on top of their routine care. We don't like to see them in their first trimester when things are most critical in fetal development, but second trimester is perfect, and we'll talk about how to position these patients as well when we're talking about patient management. There's so many diseases that researchers are investigating to decide whether or not there is a relationship between periodontal disease and the progression of other diseases. So respiratory disease is one of them. They have not yet found the link between COPD and periodontitis, but this is being researched. Chronic kidney disease, rheumatoid arthritis, which is an autoimmune disease, cognitive impairment, obesity, metabolic syndrome, and cancer. So many individuals, many patients that you see are not aware of the relationship between oral and systemic health. It's amazing how many people do not see the mouth as connected to the body. It's like it's its own separate entity that you care for, and then the rest of your body is what you see the medical professionals for. But there is a link, and it's your responsibility as their dental health care provider to inform the patient of the information regarding their individualized needs and making sure they understand it. So you want to always explain things on a basic term level that they understand. You want to keep everything factual, but there's no need to get extremely scientific. First, we're going to take a look at atherosclerotic cardiovascular disease and periodontitis. Next semester, we'll spend an entire chapter focused on nothing but a variation of different cardiovascular diseases and how they relate to oral health. But for this semester, we're going to focus solely on the narrowing of the arteries and the bacterial plaque lining the arteries that leaves the patient at a higher risk for a heart attack. So currently, there's evidence that supports an association between periodontitis and atherosclerotic cardiovascular diseases. It also supports the fact that periodontal therapy can reduce the markers of systemic inflammation. Dental hygienists should encourage healthy habits and discuss the techniques for management among other risk factors for heart disease. So you really want to educate your patients on the need for tobacco cessation, if they have a poor diet, if their blood pressure is high, or if their cholesterol is high. We won't know if their cholesterol is high unless that's something they indicate on their medical history. But if they're diabetic, they're also at an increased risk for periodontitis and cardiovascular disease. So educating your patients on diet and exercise are going to be huge with just about every disease we study that is preventable. The relationship between diabetes and periodontitis is bidirectional. Basically meaning the more extensive the periodontal inflammation is, the more difficult it's going to be to control blood glucose levels. But the same thing is true reversed. If their glucose levels are uncontrolled, then they're more likely to have periodontal inflammation. Periodontal therapy research has demonstrated improvement in blood glucose management. So if we can get the bacterial load in their mouth under control and improve their oral home care, then that will help with their glycemic control as well. On average, periodontal treatment results in approximately a third reduction in A1C levels for a 3-month period. Diabetic patients are twice as likely to get gum disease than your healthy patients. Regarding adverse pregnancy outcomes in periodontitis, studies have shown that there are 2 pathways in which the periodontal bacteria could reach the fetus. So one is the direct pathway, in which the oral bacteria reaches the placenta via the bloodstream or via ascending infection from the vagina, meaning the baby is exposed to the bacteria on the way out the birth canal. The other is an indirect pathway in which inflammatory mediators from the periodontal tissues or liver travel via the bloodstream to the fetal placental unit. The overall level of evidence linking the adverse pregnancy outcomes in periodontal disease is generally considered to be modest. Although the rates of the adverse pregnancy outcomes are higher among patients with periodontitis, periodontal treatment research has been inconsistent in reducing the rates of these adverse outcomes. Respiratory diseases and oral health. There's several classifications of pneumonia: community-acquired pneumonia, nosocomial hospital-acquired pneumonia. That's when the patients have been admitted into the hospital and they develop pneumonia within 48 hours of being there, and ventilator-associated pneumonia and aspiration pneumonia. Ventilator-associated pneumonia is when the patient on a ventilator develops pneumonia 48 hours or longer after intubation. And so basically ventilated patients have the tube going down their throat, which leaves a direct pathway from oral bacteria into the lungs. Aspiration pneumonia is when saliva is inhaled into the lungs and an infection results. To reduce the risk of pneumonia, meticulous oral hygiene should be part of the routine care for hospitalized patients, those with difficulty swallowing or those on a ventilator. This is why it would be so amazing if hospitals would employ dental hygienists to work in ICU to help keep the patient's oral cavity clean and moist. But this is not something that is commonplace at this point, and I believe they rely on the nursing staff to do this. But the nursing staff doesn't really have any training in dental hygiene. If you have any questions about this chapter, please feel free to email me. Like I said, this chapter just gives you a basic overview of the most common systemic diseases associated with periodontitis. We will cover more in depth next semester in Dental Hygiene Care 1 when we focus much closer on cardiovascular diseases, diabetes, and autoimmunity.